So we're gonna have some extra help because Greta's coming in at 3.
Okay. Make sure you get all of these included on the inventory. I'm going to begin in the production room.
Okay.
Okay.
Okay. No problem.
Let's start with the lot codes on this pallet.
Okay, shoot.
Okay, first one, N03Y.
So yeah, that does it for in here. Could you ask Kathy what she wants us to do over there?
Sure thing.
Thanks, man. Double check some stuff.
Jason, get in here. Kathy's down.
Is it safe?
There's nothing dangerous here.
Kathy. Kathy, it's Jason. I'm training first aid. Are you okay? Are you okay, Kathy? Go call EMS and get the AED.
Right. Okay. EMS is on their way. The operator wants to know if she's breathing.
She's breathing, but she's still not responding.
Yes, she's breathing, but she's not responding. Yes. Yes, he's already put her on her side. Okay. Keep checking her breathing. Make sure it doesn't stop.
As with any emergency, use setup to make sure the situation is safe before you begin to help.
Is it safe?
There's nothing dangerous here.
Kathy.
Identify any mechanisms that could have caused spinal injury. Perform an initial assessment. See if the patient responds to your voice. If not, tap her on the shoulder and shout loudly, "Are you okay?" This patient is unresponsive. Send a bystander to activate EMS. Open the airway using head tilt chin lift. Remove any obvious foreign material. And look, listen, and feel for breathing for no more than 10 seconds. Breathing is present in this patient. When a patient is unresponsive yet clearly breathing, ensuring an open and clear airway is the primary concern of the first aid provider. Continued use of the head tilt chin lift airway technique is essential while scanning for bleeding and checking for tissue color and skin temperature. When an unresponsive breathing patient is uninjured, place them in a recovery position to maintain the airway. Monitor the breathing of any unresponsive patient placed in a recovery position. A patient's condition can quickly become worse and require additional care. If an unresponsive patient has been seriously injured, do not place the patient in the recovery position. Maintain the airway with head tilt chin lift. However, if you are alone and need to get help for an injured patient, place him in the recovery position before you leave.
Good morning.
Good morning.
Checking in?
Yes,
May I have your name, please?
John Martin.
Thank you, Mr. Martin. It'll just take a moment.
This looks like such a great place. I can't wait to see the rest of it. What'll we... John? Help me, my husband's collapsed.
Mr. Martin, can you hear me? My name is Lorna and I'm trained in first aid. Can you hear me? Are you okay? He's not responding. Call EMS and get the AED.
Sure.
Please help him.
Communications, this is front desk.
Go ahead.
We have a guest in our lobby that has just collapsed. He's unresponsive. Lorna's with him. Call EMS. I'm going to get the defibrillator.
I'll call now.
Communications to Elizabeth.
Go ahead.
EMS is en route. I've contacted security to meet them outside.
Thanks. EMS is on the way. Do you want to use the AED?
Yes.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
As always, use setup to make sure it's safe for you and others before caring for the patient. Identify any mechanisms that could have caused spinal injury. Assess responsiveness by introducing yourself and tapping the patient. If there is no response, send bystanders to activate EMS and get an AED. Open the patient's airway. Remove any visible foreign material and assess breathing. This patient is not breathing. Using a barrier device, perform 2 rescue ventilations, creating a visible chest rise with each breath. Begin CPR. Locate the proper hand position and start compressing the chest at a rate of 100 compressions per minute.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 3, 4, 5, 6, 7, 8, 9, 30.
After 30 compressions, move up to the patient's head, open the airway, and provide 2 ventilations. Quickly return to chest compressions. Perform continuous cycles of 30 compressions and 2 ventilations. Do not interrupt CPR unless absolutely necessary. Remember to compress deep and fast and allow the chest to fully expand to its normal position after each compression without losing hand contact. It is unlikely a patient will improve with CPR alone. If you suspect a patient may be responding in some way, stop CPR and check for normal breathing. If breathing is found, place him in the recovery position and monitor breathing. If you don't have a protective barrier and you don't want to provide mouth-to-mouth ventilations, you can perform chest compressions alone. Someone who has no obvious signs of life has no chance for survival without your help. A patient without breathing or circulation is essentially dead. Nothing you do will harm him further.